The government's investment in the health sector over the years has been an enormous task. Millions of kina has been pumped into enhancing delivery of health services across the country. Much concentration was centered around improving the health infrastructure and procurement of medical drugs. Despite government efforts to improve the health sector, one of the most critical issues affecting delivery of health services is the workforce. Without better and effective workforce, challenges of achieving improved service delivery are high. The concern of manpower in the health sector was raised in Parliament by someone who has experienced the issue firsthand. Member for Wabeg, Dr. Lino Tom, told Parliament recently that the biggest problem faced, particularly in rural areas, is shortage of nurses and doctors. He said this is the only hindrance to effective delivery of health services across the country. Dr. Tom asked if the government had any immediate plans for increasing the health workforce in the country.
You brought forward to the Cabinet any submission to increase the health workforce in this country?
Building of modern hospital infrastructures and continuous purchasing of more medicine is not the answer to the deteriorating health services. Having experienced the impacts of shortage of staff working under him to provide medical services in rural areas, Dr. Tom is well aware of the challenges. Wages for University of Papua New Guinea Medical Fraternity was also raised, seeing the fact that many were leaving for the private sector. He said many experienced medical lecturers were leaving for greener pastures, mainly in the private sector due to their wage issues not being addressed by the state.
So tupla question me bring him the health minister. Tupla big problem inside the country. You may got him all lecturers long up, all junior to us because we are not putting in their submission through so that they can be paid at a level to retain good quality people.
Health Minister Dr. Puka Temu said the national government has increased funding of nursing colleges to cater for the growth. This will continue over the next 5 years to accommodate more nurses and doctors.
Nursing is the biggest workforce and we have a big shortage in that nursing category, so we are focusing on improving nursing colleges, which has already been taking place, and that will continue in the next 5 years during this term.
Currently, the medical faculty at the University of Papua New Guinea is graduating about 30 to 50 doctors per year. Health is one of the largest sectors in the country and needs increased workforce. The building of a standalone science university is critical at this stage.
We are, as you know, the Prime Minister has announced the establishment of a separate university for health and health sciences, rather than just a medical faculty under the UPNG. If teachers at Goroka have their own university, for example, then I think we have a very big health workforce that requires a dedicated university to make sure that numbers of doctors, currently 30 to 50 every year, we want to increase them to 100, 150 a year.
Sepuka was answering questions raised by the member for Wabeg in Parliament recently. Sepuka said the concept is captured in his 100 days plan, including continuous funding of nursing colleges and institutions. As for the UPNG wage issue, Sepuka said many medical lecturers are allowed time to do private practices in hospitals or private medical institutions in order to earn extra money. He said currently the government is yet to receive a submission for the increase of salaries of medical lecturers in universities and medical schools, but other benefits have been increased. Meantime, the government's commitment over the last 5 years has resulted in at least some improvement in the health sector. Improved delivery of drugs and health services, including new infrastructure facilities, are some of these achievements.